Procedures for root canals are frequently shunned by dental professionals because they are viewed as taking a long time and being uncomfortable. However, how long will an actual root canal procedure need to be? In this clip, we'll look at the details involved in an actual root canal treatment as well as provide an insight into the process's timeline. Regular dental procedure. Root canals are required to treat the condition of the tooth's pulp when the tooth gets infected or damaged. The reason for this could be the severity of decay, cracks in the tooth, or several dental procedures performed on that same tooth. When undergoing a root canal, the endodontist or dentist removes the pulp that is infected, then remove and clean the inside of the tooth, finished by sealing it with either a crown or filling to avoid further infection. The time required for an operation to repair a root canal may vary according to a number of variables, including the difficulty of the procedure as well as the number of canals within the tooth and the ability of the dentist doing the procedure. The average time for an operation to fill a canal could last anywhere from 30 minutes up to 90 minutes depending on the tooth. The very first step in an operation to repair a tooth is the administration of local anesthesia that numbs the region around the tooth. It is a way to ensure that the patient doesn't feel any pain throughout the procedure. When the anesthesia is in effect, then the dentist can use an instrument to create an opening inside the tooth that allows access to the pulp that is infected. After that, the dentist will utilize special tools to eliminate the pulp that is infected off the tooth. This procedure can take a while, particularly in cases of a severe infection or if there are several canals inside the tooth. Dental professionals will then scrub and disinfect the inner part of the tooth in order to make sure the absence of any debris and bacteria are eliminated. When the inside of the tooth is cleaned, the dentist then fills the tooth using a rubber-like substance known as gutta percha. It is used to stop the flow of blood to prevent any further infection. Sometimes the temporary filling can be placed inside the tooth until a permanent crown will be put in place on a subsequent appointment. The length for a tooth canal process may vary according to the specific patient. A few root canals are performed in just one visit and others require multiple visits in order to ensure that the infection is removed and the tooth well sealed. It's crucial to understand that even though root canals are often thought of as difficult, the advancement of technology for dentistry as well as anesthesia methods has made the process less painful for patients. The majority of patients experience very little discomfort following an operation to heal their root canals, and a large majority have the ability to resume the normal routine immediately following the procedure. The duration time of the root canal process may vary according to the specific case and degree of difficulty involved in the procedure. The average length of an operation to fill a canal could last anywhere from 30 minutes up to 90 minutes depending on the tooth. In spite of their stigma as a root canal, they're an essential procedure for dental care that could save the tooth from being removed and ease the pain of infection. And if you're in the necessity of getting a tooth canal, make sure you get treatment from a licensed endodontist or dentist to ensure the long-term health of your dental smile.